Hi, this is Gary from Ultimate Performance. Today we're going to be troubleshooting knee pain that occurs on the inside or the medial side of the knee. What's happening biomechanically is a tibia, which is in external rotation, sitting below a femur that is internally rotated. So look at the image above and you can see how this actually causes stress on the medial or the inner side of the knee. Something to take note here is that most of our joint movements occur in the transverse plane. What that means is that our joints rotate and counter-rotate to produce movement. And this occurs from top down or bottom up. So it's a series of internal and external rotation going down the chain as the body produces movement. So back to our inner knee pain where the femurs are rotated internally. This usually occurs because of an anterior pelvic tilt of the pelvis. So it's tilting forward. This causes the femurs to pick up internal rotation. And in order for the system to find external rotation, the tibia or the shin bone actually rotates into external rotation. So we have this presentation of an internally rotated femur and an externally rotated tibia. So in order to treat the knee pain, we usually need to start with the pelvis first. So let's get to our first drill, the hook-lying breathing. Hi, this is the elevated hook-lying breathing drill. What this activity does is that it's going to teach the body to posteriorly orient the pelvis and gain some good external rotation measures. Alright, so let's get into the setup. Here, I have a step board. You can use a couple of books. It's meant to elevate your heels in a supine position. So lie face up, place your heels on top of the elevated surface. Get a block, a foam roller, anything to place in between the knees. A pillow will do as well. Then I need you to posteriorly orient the pelvis. So think of pushing your lower back into the ground like so. Don't do like a hard push, pushing down. Then you're going to recruit a lot of your rectus abdominis, the six pack. So we don't want that. So just do a slight tuck and then elevate your bum just very slightly. Think of your tailbone, right? Coming off the mat just ever so slightly. Back is flat against the ground. Okay, so from here, we're going to commence our breathing. Now, when you're breathing in, breathe in through your nose, long open mouth sigh like you're trying to fog out a mirror. Okay, so let's demo here. Now, breath in. Keep the tuck of the pelvis. Exhale. Now, with each exhale, I would like you to keep the tuck and elevate your bum just very slightly. You should feel your hamstrings turn on. Now, second breath, breath in and exhale. Feel those side abs turn on at the end of the exhale. Hold on to them, right? You can put your fingers here to feel the side abs turn on and then go for another 3 breaths. Breath in through your nose, exhale, keeping that tuck. Elevate a little bit. 2 more breaths. Breath in through your nose, exhale. Lift off just slightly, maintain the side abs. Last breath and exhale. Hold. 1, 2, 3, 4 and 5. Okay, now most common mistake I see is the knee angle being too big and then you're gonna feel a lot of hamstring. You won't be able to do this drill properly. Now next thing, the side abs. So use your exhale. Really drag out the exhale, breath in through your nose and a long exhale. Be very gentle, don't do it forcefully. That's not going to work, okay? So drag out the inhale, drag out the exhale as well. Alright, so that's how you do the elevated hook-lying breathing drill. Go for the prescribed number of reps and for the hook-lying breathing drill, go for 5 breaths and repeat it for 2 sets. So if we do it correctly, we should be able to regain some posterior tilt of the pelvis and regain some movement options from there. Okay, so let's move on to the second. Hi, This is the knee mobilization technique. What this activity does is to restore good knee mechanics when you're bending and extending your knee. So let's get into the setup. Make sure you have something soft placed under the non-working side, and then get your knees both in 90-degree angles. Grab a dumbbell and place it beside that working knee. Okay, now place a lot of pressure underneath the heel that you're working on. Move your knee forward. Take note to push out from the hip and also drawing back from the hip. You shouldn't be moving forward and backward as a unit, the entire body. It should be this sort of like a rotational movement of your hip going forward and backward, staying heavy on your heel throughout. If you lose that heel contact, that's not going to work. Make sure you're staying heel heavy, and the next thing you want to take note is your knee should be moving towards the second and third toe, not towards that big toe where your knee starts collapsing in. So don't go too far out as well. You want to make sure that it's going towards the second and third toe as you're moving forward. Stay heel heavy, maintain heel heavy, and pull it back. Alright, if you do it correctly, you're going to feel your inner quad area, your VMOs, and also your glute working. Alright, so go for the prescribed number of reps and sets. My recommendation for this second drill will be in the higher rep range of like 15 to 20 reps. Perform it for 3 sets. So if your knee has like a pain scale of 5 out of 10 or more, I will recommend that you go for the first 2 exercise drills and keep at it until your knee is almost pain-free. So once you're almost pain-free, then let's rock and roll and move on to our final drill where we tie everything in together. This is the split squat with a ipsilateral load or same side load. What this activity does is going to train some good hip external rotation on that front side leg. So let's get into the setup. Start on the ground with one knee on the ground. I'm going to demo with my left knee on the ground. Grab a light weight. Okay, place it beside the front leg. Now start off with this knee slightly in front of your ankle. From here, we're going to stand up. Okay, place pressure on the inner part of your foot. Okay, make sure that you're pressing down with your heels. Don't let the heel come off the ground. Maintain heel pressure throughout and come up into this top of the split squat, and we come back down again. Something to take note, your knee has to be going towards the second and third toe. Don't let it collapse in or travel out to the 5th toe area. So let's go at it again. Make sure that you're staying heel heavy, standing up, and then coming back down, moving your knee towards the second and third toe while staying heel heavy. Okay, sense your heel all the way. Let's go for one more rep. Pushing back, sensing your heel on the inner arch area, and coming back down onto the ground, knees going towards the second and third toe, staying heavy on your heels. Alright, that's how you do the split squat with a ipsilateral. For this last exercise, work within the 10 to 15 rep range and perform it for 3 sets. So you don't need a very heavy load for this last exercise. Sometimes even body weight is just good enough, and focus on good execution of the exercise. Good form and technique usually goes a longer way than actually increasing load, where all sorts of compensations actually take place. So if you found this video to be helpful, please like and share or subscribe to the channel, and I'll see you the next time. Take care.